Welcome in Medical Informations. Our topic today is left ventricular aneurysm, the serious complication of coronary artery disease and myocardial infarction. About this theme, we speak today with Professor Lorenzo Menicanti, the first and the most expert in the surgical treatment of this disease, Chief of Department of Cardiac Surgery and Scientific Director, Policlinico San Donato, Milan, Italy. Professor Menicanti, what about left ventricular aneurysm and its causes?
As you told, is one of the most important complications after the acute myocardial infarction, and normally we know, according with the different experiences, that about 20% of the patients that experience acute myocardial infarction have a dilatation of the left ventricle. This dilatation is the first risk factor for mortality in the follow-up period for this type of the patients. So the idea of left ventricle reconstruction is to exclude from the cavity the diseased tissue, the scar tissue. In this way we reduce the volume of the left ventricle, and this way we reduce the wall stress of the left ventricle, and we increase ejection fraction. In this way we reduce in a very important way the risk of mortality of this patient, and we gain in terms of life expectancy and the quality of their life. If you want, we can see in this cartoon what's happened after an acute infarction that involved the left anterior descending coronaries. That is the most frequent type of infarction that determines the dilatation of the ventricle. So, as you can see, we have a dilatation of the left ventricle with displacement of the papillary muscles, and this is the reason for what the ejection fraction is fall down, and the reason for what the patient has a very bad quality of life is one of the most frequent cause of heart failure. This is a magnetic resonance, and you see how big is the dilatation of this ventricle. So technically it's possible to exclude from the cavity all diseased tissue. In this way we will rebuild almost normal ventricle. So you can see we open the left ventricle in this way, and we check inside the extension of the scar, particularly on the septal portion that is here, as you can see here clearly. We insert a sizer that will give us the good volume that we want to achieve after the procedures. And over this scaffold, we rebuild the left ventricle cavity with exclusion of the scar tissue. In this case, we use a patch, as you can see here, but normally this patch can be avoided, and the closure is directly without prosthetic materials. That changed completely the natural history of the pathology, because the ventricle is arrived to have a normal volumes, and this way is the key to gain quality of life and to gain expectancy of life. We have important experience of this. We treat in San Donato more than 2,800 cases with mortality, operative mortality that is low, because it's less than 5% with this type of patient, and we have a life expectancy at 5 years about 75% of our patients. That it's almost the double of the compared population that you have this type of increase in the volume of the ventricle.
What about the surgical treatment of this disease?
As you can see in the cartoon, the surgical treatment consists in the exclusion of the scar tissue. And of course, beside that is intensive revascularization. All the patients that we treated are revascularized, except the patient that we have open arteries because they got angioplasty peri-infarctual time. So the goal of this surgery is a complete revascularization and reduction of the left ventricle volume.
Can you give some advices for patients after surgery?
Well, it's really very important that even we achieve a good type of correction of this disease, the medical therapy is absolutely necessary for this patient to maintain the results. So the advice that we give to our patient is to stay stuck strictly to the medical therapy, because sometimes the patient feel much better and they try to reduce the drugs. That can be done, but under the strict medical survey.
Thank you, Professor Melicanti, for having you today. Thank you very much.
It was my great pleasure, and I hope that this small chat will be useful for knowing more intensively a pathology that sometimes is a little understood.